Good afternoon. Thank you for coming to Early Learning Caucus. We know that we have some people who are intending to come and are held up, so we'll go ahead and get going, have some discussion today, but then likely what we'll end up doing is as we have more people join, we may circle back on the topics. That way we can have all the information out there and helpful. The good part is we also have some handouts for takeaways, and I'm happy to chat with anyone afterwards if they were interested and unable to come. So today we're going to start, this is our fourth and final Early Learning Caucus of this legislative session, and we are going to look at some perspectives from the child care workforce, how the members of the child care workforce perceive their work and what they're doing. And we will start today with Kansas Child Care Training Opportunities, ks.gov. They will speak about the findings of their study about the child care workforce, and then we will also follow that up with perspectives from United Methodist Health Ministry Fund, perspectives of the child care subsidy, a study that United Methodist Health Ministry Fund completed about child care provider perceptions of child care assistance and how that system is working. So from there, I'm going to invite, hello. I'm going to invite ks.gov up to start talking about their study. Yeah, house is still on the floor. We decided we'd go ahead and get going and then circle back with the meeting.
Hi, I'm Stephanie Parks from Kansas Child Care Training Opportunities, otherwise known as ks.gov, and I'm joined today by my colleagues Dr. Clarissa Corkins and Patty Peschel, the Executive Director of ks.gov. ks.gov is a nonprofit organization. It's housed at Kansas State University. And our main funding source is child care development funds through DCF. For over 30 years, we have supported child care providers statewide, offering in-person, live virtual, and online professional development. And we work closely with agency partners such as Child Care Aware, as well as other early childhood departments, including KDHE, KSDE, and Children's Cabinet. Last year, we provided training and technical assistance or coaching to over 12,000 child care providers in Kansas, and this includes individuals who are brand new to the field and need their health and safety training, for example. ks.gov is also the lead CAPE implementation partner. CAPE is the new career portal and registry for child care providers, and we recently hired career navigators whose role it is to offer individualized supports to help people advance in their career. They will work closely with higher education institutions, and all of this will be accessed through CAPE. Today, we are here to elevate the providers' voices by sharing our findings from the Early Childhood Care and Education Comprehensive Workforce Study that we conducted last year. So this study represents it is, yes. Over 5,600 providers from all 105 counties in Kansas. The study is comprised of 2 parts, an online survey and also a focus group. And you can see on the map, the darker the purple, the more people who participated in the online survey from that county. And in addition to the survey, there were 39 focus groups that were held across the state. Those where those little pins are. We were particularly interested in learning from both the professionals who make up the current workforce, as well as those who left the field. And those are represented by the light blue box. To that end, we collected data from both current and former professionals in the workforce. And the subset of data that we'll be presenting today is from direct care and education professionals, from centers and family in-home child care, represented here in the green box. Do you want to step up?
Oh, no.
Okay. Findings confirmed what those of us who work closely with direct service providers already know, that first and foremost, early childhood care and education professionals are incredibly passionate about young children and families in Kansas. And when asked what influenced their decision to enter the workforce field, 88% reported their passion for working with children as very or extremely influential in their choice to enter the workforce. And these sentiments were also persistent throughout focus groups. This slide shows the age of those who are currently in the field, and you can see the middle bars there. You can see about a little over 20% are in their 20s, 30s, 40s, and 50s. Many in the workforce have college degrees, certificates, credentials, teaching licenses. In fact, 71% have some collegiate experience. 83% of providers are moderately, very, or extremely interested in additional training, additional certifications, and interested in advancing their degrees. A common sentiment shared by focus group participants was that turnover is a persistent challenge. And 80% of our workforce focus groups discussed significant staffing and turnover challenges. We also wanted to know about regulations, how people felt about the regulations, and how those are viewed, and if they're viewed as a barrier or negatively impacting recruitment and retention. And so we asked, and the results are on this slide and the next two slides. This one is over 66% agree or strongly agree that qualifications to become an ECCE professional are reasonable. Those are represented by the blue bars. Startup processes for in-home childcare were easy to navigate. Again, agree is the blue bars. Only 17% disagreed. Regulations to operate a childcare center are reasonable. Only 9% disagreed with that statement. Let's look at compensation. This slide shows in the top left corner that when we looked at a data set of just full-time centers and in-home providers, 36% make less than $25,000 a year. 18% work an additional part-time job or a full-time job. And over 27% experience food insecurity. There was another study that was done out of Berkeley at a national center, and they projected that Kansas is the 6th lowest payer of child care providers at $9.93. Benefits. So in terms of, this graph shows the percentage who reported receiving benefits from their workplace. Those are in the dark blue parts of the bars. So you can see that 23% received a 401k or retirement plan, 21% have health insurance, 19% have dental insurance. So I shared at the beginning that we also recruited people for the survey who have already left the field, and we wanted to know why. What were the reasons for that? So of the 669 people that left the field, we asked what their reasons were, and this is in rank order. So at the top, 72% said low pay was their reason. Next was benefits, and after that was work environment. And it goes on down the list. You can see number 9 toward the bottom of the list was COVID. I honestly thought that one would be higher, but. And finally, I'd like to share some results of some open-ended questions that we asked. And so we asked, how can the community better support ECCE professionals? On the left-hand side, the responses fell into 3 big buckets: grants, collaboration, and respect. Grants in terms of materials and facility improvements, teacher discounts, that kind of thing. Collaboration, childcare and school district collaboration, between centers, collaboration amongst centers in a community, and then also better partnering with licensure. And then the third big bucket was respect. They want to be viewed as professionals and not babysitters. They want appreciation and recognition, and they wanted parity for family childcare. FCC stands for family childcare or in-home childcare. And then the next question that we asked was, what can Kansas, the state of Kansas, do to support you better? And this data was very easy, much easier to analyze, because nearly all of them said something about better pay, benefits, or grants or funding. Funding for scholarships, materials, and improvements. And then also some of them mentioned changes to the food program, just have one tier instead of 2 tiers for reimbursement. That's all the time I have today. So I wanted to also let you know that in your folders, there is, let's see if I can find it. Looks like this. This is the entire list of all of the questions that we asked on the survey. So if there are additional topics or data that we didn't discuss today, and you are in session and you have an urgent question that we can hopefully answer for you, please contact us. We want to be transparent. We want the voices of the professionals to be heard. We are more than happy to drill down. If, for example, you're interested in what center director said in northwestern Kansas and about well-being or something, please contact us. We are happy to drill down and get you very specific data for the questions that you may have. We are open to, we can stand for questions now. Yeah.
I will just tell you that I'm real pleased. I will just tell you that I'm thrilled that my perceptions have been corroborated by your findings, that the biggest issue is, and regrettably generally on each individual's part, but that pay just doesn't cover it for them. And that it's not regulations, it's not many other things that I've heard that it is. You know, even startup was not that big a deal. So that's exciting. Thank you.
We're hopeful that this data can be used to help you make decisions. Any other questions? Yes.
Supposed to speak into the mic. So you mentioned the food program and the 2 tiers. Can you remind me about the difference in the tiers and how's that reimbursed?
Patty Peschel, Executive Director for Casito, and specifically in the data that Stephanie was providing, that was about food insecurity, about...
She's talking about the, on
food reimbursement?
Yeah, food reimbursement.
Oh, on the, yes, on the, you mean in terms of what supports they were looking? Yes.
People wanted
And
just 1 tier.
yes, pay parity for FCC. That is the one, correct? Yes. Yes, and that's, so what they're referring to there is that FCCs are reimbursed at a rate, the tiers are different for the two, yes.
So just give me a little background about that. Why would you have a difference, or what were they trying to cover, and why isn't it working?
During COVID, I think that there was just 1 tier. And then when COVID was done, then when COVID was over, they've gone back to different tiers again. So they're reimbursed at different rates.
Senator Francis, so it's in the federal farm bill, and they have 2 tiers, and they were briefly combined. And then when all of the COVID programs expired, it's 2 tier. But for whatever reason, USDA and Congress has decided in-home gets a different rate than its center. And so it's just hopefully it'll get changed in the next farm bill, but.
That's helpful. So this is not something the state could change. This is a federal.
We could.
Thank you. It's always good to have a variety of senators with a variety of experiences.
No, you're good.
Thank you very much. And just not a question, but a comment. I'm a former school superintendent, and actually we opened, when you had your buckets, we opened a preschool daycare, and we're able to have some grant money available to do that. It was a great service for our employees, and we had several tell us that the reason they came to our school as employees is the fact that they had that available to them. So, yeah, just to reaffirm that that is a very tangible way to get a lot of things done. Thank you.
Great. Thank you. And so what we'll do now at this time, we will shift gears a little bit to talk about childcare subsidy and the perceptions from the childcare providers about that system and how that works. And I appreciate the questions you all have brought up, and we'll keep going.
Emily, can you email?
I'm sorry, say that again.
That was the
There-
one. Perfect. No problem. I'm good. Perfect. Good afternoon. I'm David Jordan. I'm the president and CEO of the United Methodist Health Ministry Fund. We're a statewide health foundation based in Hutchinson. Our mission is to improve the health of Kansans. We're 39 years old, and over the course of our history have helped provide over $80 million in funds to improve the health of Kansans. We focus on three areas: access to care, thriving children, and then an engaged congregations and communities program. So we appreciate the opportunity to connect today. I'm going to spend a few minutes really talking about the child care subsidy program, which I don't think we always dive deep into, and it's a little bit in the weeds. But the child care subsidy program, or child care assistance, or the child care development fund, really has the potential to be a key financing mechanism for the child care sector in Kansas, but it's fully underutilized. So the reality is that families up to about a family of four earning up to about $75,000 a year is eligible for child care assistance. However, just 12% of families are participating. So it's really an underused program that could benefit both families and providers. And a big reason why it's underutilized is because providers aren't participating in the program, largely because some of the red tape and regulatory challenges, which is what we'll get into, with the program and how it's administered, and really how they're paid, which is different than how other work support programs pay providers like Medicaid and medical professionals. So we wanted to understand what child care providers' perception was of the program, how they interacted with the program, and to see if we could come up with some recommendations on how to improve the program. Not necessarily asking the legislature for more money, but how can we reduce any administrative burdens on providers, on families, to make the program work better for the people that interact with it. So the Health Fund partnered with Kansas State University's Department of Child Care. Dr. Jennifer Francois was the one who led the report, and I'm really presenting her data. This data was collected in the spring of 2024, so it's about a year old. We released the report in the fall of 2024. And there is some positive changes that have been made in terms of rates, which are identified, not surprisingly, as something. But largely, I think there's still opportunity to improve the system based off of this direct feedback. So just as background, we surveyed over 300 childcare providers representing 93 of the state's 105 counties. So the vast majority of providers that were surveyed were home providers, so family-based providers serving between 1 and 5 children. And family providers obviously are foundational in Kansas as our centers, but the vast majority of our providers are family providers. They're serving some children who receive subsidy, not largely serving children with special needs. And most of the children served are from white families. Just in terms of subsidy participation, 43% of the providers that participated in the study reported receiving no outside funding, so no grant funding from the state, and half of them were receiving subsidy. So I think there's a good cross-section of who participated in this research study. 60% of the providers reported they are approved to accept subsidy, and half of them, about half, are serving at least one family. So there really is a good cross-section of who's worked and then of folks that may not have worked with the program, and we can learn from both. We did want to understand the different rates that are paid for through the Child Care Assistance Program. And there's a difference of about $50 a month between families that receive assistance and families that don't receive assistance. And $50 a month does create some barriers, but pay really wasn't the largest issue. So we did want to break the group up into cohorts, programs that were never approved, and understand what the barriers that they faced, why they didn't want to participate in this program, which we see as a way, how can you create some steady cash flow, some certainty for families. They had prior negative experiences with the program. There were logistical challenges getting approved. There was a lack of knowledge about the program from families and from providers. There was some financial concerns. They were full in some cases, so there was sufficient enrollment. And there was a preference for private pay families. And one provider's comment, which we pulled out, was that she didn't want families have to struggle waiting on a phone call all day and filling out continuous paperwork with DCF just to try to get their kid into assistance program. It made it difficult for them and for the families. So I think that's just an important piece to hold, and I think something we all could work on. So barriers to participation for programs that had participated before: negative experiences, financial issues, administrative burden, lack of need for qualifying families, changes in business structure, and personal preferences. I think there's some themes we're seeing emerge from both cohorts around the administrative burden and some perceptions of how the program works. So we wanted to know what would increase participation. Higher reimbursement rates, obviously, is a piece. And I would say that DCF is actually, the Children's Cabinet and DCF have worked to increase reimbursement rates through a new way to calculate the rates since the study was done. So I think that that's one positive, and I think we'll learn more in the coming years to see if that's alleviated any concerns. However, one of the biggest challenges is right now the payments for providers are not paid to them directly. They're putting money onto it, families like EBT card, and the family is having to pay the provider. So we're creating this extra burden. We would never ask healthcare providers to not get paid by Medicare or Medicaid or Blue Cross Blue Shield directly for the services they provide, because different things can happen with families. They may move. They may not end up making the payment that they were supposed to pay. There may be confusion with the card or a lost card. So not having the certainty of how they're going to get paid and by who creates real barriers. And we're one of 4 states that doesn't pay child care providers directly for child care assistance. So I think that's just an important barrier that we recognize that we're different than most of the country. Additional support in navigating the system, resources for development and technical assistance, and then just the system to manage the program. So I think other than rates, 4 of those are really administrative barriers, and I think there's ways we can probably solve them. They're technical issues. Characteristics of an ideal child care system. So I think that this is also just really instructive. So streamlined payments and communications. How can we make sure that if providers sign up to participate, that we're following through on a program that provides them certainty and continuous payment and good communication? How can we make sure the program is more efficient and simple to administer? And how can we make sure there's fair and equitable access? So, I think it's really telling that those 4 characteristics don't have to do with increasing rates, and I think, again, there's opportunity there. We do think that there is a component that also isn't related to policy, and I think it's some bias in terms of as we think about equal treatment for families, and I think this cuts across class and income, but it's helping childcare providers know there's supports out there, and there may be a difference in dealing with a lower income family than a family that doesn't need subsidies. So what are the best ways to operate your practice? How can we ensure confidentiality so that kids that may be receiving assistance, it doesn't become a concern or they're not othered in some way, and how do we help maintain financial records in a comprehensive way? So a comment pulled out was when we have a family who falls into a financial bind, we work with them to come up with a payment plan. And I think we want to make sure providers have the flexibility to add this childcare assistance to the mix. And I think also the other piece was providing flexibility and support to providers. There is certainly some misconceptions and stigma, and I think this is education and work that can be done with providers. Just they recognize that there's that while they may not be judging folks based off of income, that there may be some stigmas to overcome with staff or other providers in terms of the families utilizing this program may lack education or looking for handouts, which isn't the case when we think about the families eligible in Kansas, particularly, over 50% of families with kids under the age of 5 live at below 200% of the federal poverty level. So we're really talking middle income earning families with families of kids under 5. But how can we make sure that we're also enhancing quality experiences, because there is some behavioral and educational stigma. I actually think I covered that. So I think the other piece that we heard from providers is how can we create policies from a state level where policies are inclusive, there's an open door approach, there's collaboration and networking, and cultural sensitivity to build programs that are equitable. So we had 5 recommendations from the report, examining existing systems to streamline processes, adopting direct payment to providers, assessing alternative fee structures, increasing awareness about the program to dispel the myths about families, and then increasing support for providers. In terms of, again, only one had to do directly about money and increasing pay. So I think there's 4 other recommendations here. So there's, consistently concerns about excessive paperwork for families and providers. And I think how can we really dig in to make applying for this program more simple for both families and providers? The forms, consistency in language, online portals was just a desire. It's things I think we take for granted as a foundation, and I know policymakers probably think that these systems exist. And I think, 1, let's audit them, and 2, how do we make it simpler for families and providers? 2, adopting direct pay. As I mentioned, 46 other states pay providers directly. How can we do that? Can we look at what other states do, find a cost-effective way so we're not creating a big system so we can pay providers directly? It would make a huge difference in, ensuring a timely flow of payments. So if we're asking providers to take this on, we should be able to pay them on time. Looking at the alternative fee structure, I won't spend too much time here. DCF and the cabinet have done some work on this front. And then increasing awareness to dispel myths. I think I covered in depth, and there is work that we can do in philanthropy to increase support for providers. So I'm happy to answer any questions, and It's below. It's just a single handout that was under the folder. Yep, the highlights are there. Yep. Senator.
Thank you for looking into this. And especially the direct pay makes a lot of sense to me. Wouldn't that also save the state money?
I think it could save the state money. I mean, there may be some initial upfront costs to create the system, but I think it does ensure that payments are going directly to providers, that you're approving them, and that it's streamlined.
It seems to me that there would be a fewer number of payments if you were paying providers than if you were paying the participants.
Yep, absolutely. And I think I think you'd also reduce the amount of time providers are spending on the phone talking about, like, where is our payment? Like, is this person enrolled? And I think that's another challenge. And we can simplify the process all around.
We should have the Department of Revenue weigh in and support.
It's helpful. Well, thank you. Yeah, I'm happy to discuss any questions you may have, and we may dig into some other questions to get some even more specifics on the other administrative challenges that providers face, some additional qualitative research.
So what would it take to make that change? Is that a rule and reg? Is that in statute? Why are we doing it the way we're doing it?
It could be done administratively. So it doesn't require a change in statute. I think that there was just an approach thinking that this helps have skin in the game for families, and aligned it with other work support programs like how SNAP works. But I think the reality is it's more closely aligned to, say, how Medicaid works or other systems where you have a payer paying a provider. And I think it's time to re-examine sort of like what this looks like.
Have there been any discussions with the governor or with the department?
The department's been very open to the recommendations in the report, as has the governor.
Thank you.
So the people who need to make the changes are on board to make the changes? Is that what you just said?
I think that there's interest in the recommendations.
Good.
We may have a few other steps that we need to work through.
Right. And so what can a couple of senators do for you?
Well, I think I'm happy to talk more about some of the technical details, but I do think, asking, supporting work with DCF to help improve the enrollment process for families and providers in subsidy is important, supporting any efforts to formally change that. And I think the same with direct pay. And then I think we'll see how those conversations evolve, and there may be some more specific requests after that.
I was thinking that in the budget process, I think some legislators are wanting to make investments that they know down the road will save us money. And I think that's how this needs to be presented, that if we could find the money in the budget to bring up the system, then overall, we will be saving ourselves money in the future. And also, any early childhood care and education we can give will save us money in the future.
Absolutely, and create jobs. I appreciate that. That's helpful.
Did you suggest, though, that the cost would be pretty small?
I think one of the things, I think different states have a different range of costs for the system. So I think that would probably be working through what's the right size system for Kansas. And I think there's also, is there ways to leverage dollars from businesses or philanthropy to help with some of that process. So I don't have a price tag for a system in mind. I think there's different totals that could be out there. So I think that's something that could be determined as part of this discussion. But we're not talking, tens of millions of dollars.
Well, it's a huge factor on the Commerce Committee. We hear about childcare being a roadblock to a lot of things, so besides caring for our children, our future, and we love and want to cuddle them all, but it's a huge fiscal factor as well.
It is, and until last fiscal year, we were one of the only states that wasn't taking advantage of the full federal match on child care development funds because of our levels of participation. So last year, we've sort of hit our full federal match, but I think it just falls into also fiscal responsibility on that end too. Well, thank you for the great questions and discussions and suggestions.
I appreciate the questions and the conversation. Thank you for the thoughts you have brought to the topic and the interest that you have shown. The goal of the Early Learning Caucus topics this year was to show the collaboration that's happening within the early childhood system. We began a few weeks ago highlighting the dynamics that could be offered to Kansas when we consider streamlining the early childhood governance system. And then from there, we moved on to talk about home visiting programs that are offered within the state. That was a topic that happened last week. This week, now we're talking about perceptions of the child care system and kind of looking at that broader view of how they interweave and connect with each other. So I really appreciate the conversation that was able to happen here today. You have those materials from each organization. I can also make sure to sit with anyone and answer questions about, some of the previous topics, home visiting, things like that, dynamics of the early childhood system, so that then we can work towards that common goal of how are we benefiting children the best, and how can they have the most robust early learning experiences as they grow. And so we're happy to answer any other questions and kind of go from there. So thank you. We really appreciate your time. Thank you. And thank you for lunch. Absolutely. We are glad to have you.